You know, there's, you know, part of the big cost of medical care. This is these are financial pressures that just not us are facing, but pretty much all industrialized countries in the world are facing. It has to do with in the past decades with advancement in medical care, more costly technology, whether it's advanced surgical techniques, whether it's imaging studies, MRI scanners.
I noticed though lately that now there's some question about the safety of MRIs and CAT scans being overdone.
Well, there was a report recently about the for instance, the radiation exposure that people are getting with CAT scans, and if you walk into an emergency room, you know, with any type of symptom, you're practically going to get a CAT scan of your head or your chest or your abdomen.
Yeah.
And there is certainly a large amount of radiation exposure with all these tests that people are giving, and there is some concern that it might be increasing the cancer rate slightly over time. That's tough to pin down exactly what those numbers are.
Oh, I'm sure there's always disagreements over these things.
Yeah, but certainly there are costs associated with these things, and then you talk about modern pharmaceuticals.
Oh yes.
I mean, now, granted, the cost of pharmaceuticals is very high in this country. It's no accident, though, that all the major pharmaceutical companies in the world are located in the United States practically.
But you can get the same medicine up in Canada for half the price, but you're not allowed to bring it in.
That's true. They do, all the pharmaceutical companies tend to focus a lot of their research and sales in the United States because that's where they can make the biggest profit. And that has helped the advancement of medical care. I mean, a lot of pharmaceuticals, I mean, they have done great things for people, whether you're talking about cardiac medications, chemotherapy agents, diabetes medications. I mean, these are all things that we have to treat people for, which is another pressure on the cost of health care, is the aging of the population. And just like most other industrialized company, as people get better health care and they live longer, they start to develop more diseases, heart disease, cancer, diabetes. They need more medical care, they need more pharmaceuticals. That puts added pressure on the healthcare system.
I don't know if you get a chance to watch television with your busy schedule, but I got to tell you, the pharmaceutical ads that run on television these days, I take one look at them and I say, I don't want to take that stuff. You know, in some conditions, the after effect may be death. They go through, and also the paid advertisements in the magazines. I guess they have to do that, do they now?
They do. The disclosures is part of what they have to do from the legal department. Yes, I mean, I don't think most of us in medicine are in favor of, you know, the overexposure that a lot of these pharmaceuticals have gotten on the television advertising. That's a little too much.
I agree with you. I would like to see it gone.
I'm not sure there's any other industrial countries I can think of that even allow advertising.
Not in the UK, I can tell you that.
Not in France or any countries like that. They're not allowed to advertise.
Speaking of insurance companies, one of the questions I have for you is, operating out of your Bowie office, which is right next to where my office used to be, what are your frustrations with the insurance? I mean, you must go through an awful lot of work having your people cope with the vagaries of insurance and the variables and what have you. Is it a time-consuming thing?
Oh, it's very time-consuming, and it's a constant struggle with the insurance companies, whether it's payment or in their case, denial of payment for certain tests or for level of office visits. We're constantly dealing with the denial for people's medication. They don't want to pay for this medicine. They want to pay for a cheaper medication, a generic medication. So we're constantly on a daily basis, having to spend time trying to get people the medication that we've prescribed for them or we think might be best for them. Trying to get them to get the proper tests that they need, whether I think they need an MRI scan or they need to see a certain specialist. We employ a person full time just to deal with the insurance companies as far as authorization and referrals.
Wow.
I mean, these are costs that are added into the whole healthcare system numbers that you were talking about earlier.
We had a family member of mine visited you, and you sent her off to get a CAT. And for some reason, the insurance company kept delaying the approval. You have to get it pre-approved. So it wasn't pre-approved. She wanted it. She needed this. So we went down there and said, well, I'm sorry, we haven't got the insurance approval yet. She says, that's okay, we'll charge you half price. I mean, now wait a minute. They're charging the insurance company twice what they're charging me because I wrote a check? That's kind of bizarre.
No, they may be doing a cost-benefit analysis. They may realize that in situations like this, that if you get a group of people and they all require prior authorization, the insurance company is going to maybe approve half of them.
Okay.
And so they'll get reimbursed for those. And the other half, they're going to deny the authorization. Okay. So they're going to come out even or come out ahead if the insurance company denies it, to just go ahead and
get the cash
and get some cash up front and do the procedure.
Well, the insurance company actually did come through and pay for it anyway, but they paid my wife what you paid.
Yes, we struggle all the time. It's less a burden on us, but the hospitals, the hospital where we work and we admit patients. The insurance companies have very strict reimbursement policies to these hospitals about how many days they'll authorize a patient with a certain condition to be in the hospital. And if the patient's too sick and can't go home, that doesn't matter. They won't get paid anymore. And so the hospital just has to sit and eat the cost of those extra days in the hospital. And a lot of community hospitals have a lot of financial problems because of these insurance company policies.
I've heard a rumor that hospitals aren't actually as profitable as people think they are. It's the insurance companies and the big medicine places that are actually making the big bucks.
Oh, absolutely. I mean, if you look at the business returns, I mean, the insurance companies are the ones that are in the Fortune 500 companies. You're not going to find any even major teaching hospitals making profits like the insurance companies make.
Well, when you go to one, though, we went to Georgetown University Hospital, and after a 2-hour session, when the bill came, I nearly had a coronary myself. I couldn't believe the amount of money. Fortunately, the insurance company paid most of it, but woo, that's a lot of money.
Yes, and it is, and it's a expensive business to run. Yeah. And whether it's the cost for equipment, the cost for liability insurance. I mean, that's a whole another area that we deal with in medical care. That probably again goes into those statistics about the cost of medical care.
Yeah, yeah. I was also amused to get a couple of weeks later a telephone call from Georgetown asking if we'd be willing to donate to their program. Yeah, right. Let me pay off this first. Well, are you hopeful? I mean, you're obviously probably very hopeful that the future of medicine has nothing to go but upwards, improve.
Well, certainly, I mean, medicine as a discipline, as a science, yes, is going to keep.
I think more. I'm speaking more medical care, the type of practice that you have right here in Bowie with your patients and so forth.
Well, yes. For instance, this health insurance bill that's just passed, I don't think per se it's going to have much of an effect on us directly on a day-to-day basis.